The country director of ZIPLINE Ghana, Elkoche Enkomo, about ZIPLINE Jumedie, Yomudie, Ewo Maigadamo. Shewe, Ebaisia. The moment you're watching, Makwaba and Famra Begum Jumedie so on Adom TV, live on DSTV channel 280, Go TV channel 119. Multi TV, Diggy Boston say live and so streaming on all our social media platforms from Facebook to YouTube. Baby Abokobiano, when you're Adom TV. Ashe. Mededi akwesi ensia so no pay komo a yedi kan edi na ehon sem aba about ZIPLINE adwuma ya woye ewo Ghana hanom. Say under the leadership of His Excellency Nana Addo Dankwa Akufo-Addo, aban no kofa de bi eba ya yesi eye wiemhyen kuma ya se moja enuro ene ko ba bi aka entimi enu wontentemu a ZIPLINE for the aeroplane kuma no be soa sa enuro no ene emoja no ene ne ma hospital no hia ne tentem so no etimi akọ na aban sesan ya His Excellency John Dramani mama aban eba ye ena se ma akọ bia betodwa ayese ekabese 170 million Ghana cedis eda ho ena akọfa adwuma na ZIPLINE kasa eye edeba na hu sense bebre ebi mo aka ma mbeka ya last week Dr. Beyo ebe kan wo bedwam so se ZIPLINE kwan wi echi nom de omufidie no eswa condoms ekoma hospitals no ebi no krebe no sa ensem no emu anapoyensa aka the chief executive officer edema ZIPLINE Ghana Limited edmeku Daniel Merki ewa hadmo a ye no betwi enko bibinti ye poto kasem. Danny, good morning.
Good morning. I hope you didn't sell me.
No. Okay, so making our viewers understand where the conversation has started from for the past a week ago with about operations of ZIPLINE. So I pray you're doing well.
Yeah, I'm great.
Are you still in operation?
I mean, we are operating 3 out of the 6 distribution centers, and the 3 others, as announced, have been decommissioned since 25th, so since last week Tuesday. So since last week Tuesday, about 3 of your centers are not operating? Exactly.
Can you share with us what has caused this suspension?
I mean, I think we stated clearly that it was mainly financial reasons. It was no longer sustainable for us to run the operations, and we had ongoing discussions already with the Ministry of Health a while before this decommissioning happened. So we provided them with the timelines and everything, or with the deadlines towards a potential shutdown. And the 2 things that were really, really important for us was, yes, the financial side, because we needed to run a sustainable business. And the second one was like an integrated framework where there's clear direction from the Ministry of Health so that we feed into the government and agenda and can really support across Ghana.
Okay, so what has been the reasons for the delay in payment of the about 170 million Ghana cedis debt?
I think that in terms of reasons for delay, you'd probably have to ask the ministry side rather than us. But all I can say is that during this entire period, we have been a good partner. We have really tried to go the extra mile, really tried to provide all the services. There was an instance earlier in the year where when the USID stopped working, we picked up the deliveries at no extra cost to the government. Of course, that falls within the mandate if you're looking at it, but what I'm saying is we took the initiative up on us to really go in and support as quickly as possible.
Okay.
Yes.
Okay, so this issue of ZIPLINE operations in Ghana, how often was government of Ghana paying for your service that you delivered to the state?
How often?
Yeah.
I mean, we are running 6 distribution centers, so usually we bill the government on a monthly basis, right? Okay. And I mean, I've been saying that in all the interviews that I've been giving, there's still ongoing discussions, so I don't want to go into the nitty-gritty of all of these things, because ultimately what really matters is, for us, we want a resolution. And the reason we want a resolution is not just from a business perspective, it's because we are serving people in those regions. In the 3 regions that we decommissioned, when you look at it, across Ghana, we are serving more than 3,000 health facilities as at now.
Okay.
Around 1,200 are affected by, are served from these 3 distribution centers. When you look at it, the total population is around the 17 million that we can serve out of those 3 distribution
You're
centers.
serving 17 million
Yeah.
out of about 32 million population.
Yeah.
Okay. So since this government took over, have you received any payment from the government?
We haven't.
You haven't?
No.
Have you engaged the ministry?
We have.
And what's the response?
I mean, we are still engaging with the ministry, right? So that's why I'm saying it's very difficult for me to give you a lot of details around the payment. And ultimately for us, I mean, we are a service provider, we are an infrastructure that is at the service of government, irrespective of who is in power. It's not important to us. What is important to us is that we can save lives, we can integrate, we can expand across the country so that all Ghanaians get access to healthcare commodities. So that's our focus. And even with the business, we haven't had a strong profit motive or intention that we went in. We are trying to cover our costs so that we can build a sustainable business. And of course, over time, eventually, technology, you can find ways and means to drive down the cost. You can find ways and means to have different use cases beyond what we are doing. And then eventually, maybe, yes, you can turn a profit eventually. But our motive here really was to break even. And even, I mean, with this situation in terms of payments, we have not had that since our inception, basically, right?
How did you get to work with the government of Ghana?
How did we get to work with the government of Ghana? I mean,
because you're a foreign company.
We are a foreign company, but we started operations in Africa. So the first company, the first operational country was Rwanda.
Okay.
And then Ghana was the second country. But then when you look at it, of course, Ghana is a larger country than Rwanda. So in Ghana, we are operating 6 distribution centers, and I already told you around the numbers. And in theory, in Ghana, because we are trying to become nationwide infrastructure in the countries that we are operating in. Of course, in Ghana, I would say for now, the priority is not to become nationwide infrastructure. The priority is to find a resolution to this and then integrate deeper rather than go broader.
So how did this relationship start? Who got first in touch with you, or you wrote a proposal to the government of Ghana detailing what you can do to help our health sector? How did it happen?
Yeah, I mean, even me, I can't tell you all the details. I mean, the company since a year ago. I can see in which direction you are going in terms of that question. But what I can tell you is that ZIPLINE, you can look at our investment base, who is investing in the company. You can look at everything within the company. We are a full US company that is trying to find suitable markets across the continent where we can deploy this service, this infrastructure.
So do you have a service delivery in the US?
Sorry?
Do you deliver any service to the US?
I mean, right now we have a new technology. What we call the technology that we are deploying in Africa, we call it Platform 1. So that has been the technology that we have been deploying for years now in Africa. And eventually we developed a new technology which we call the Platform 2. So that technology is more focused on urban areas. And that's the technology that we are focusing on scaling in the US.
So apart from Rwanda, Ghana, which other country has benefited from your service?
Nigeria, Kenya, and Cote d'Ivoire as well.
So before coming to Ghana, you had all these countries that experienced, or you after getting to Ghana?
No, Ghana was the second country.
Ghana was the second country.
Ghana was the second country, operational since 2019. And I would say if you want to do a comparison even from Ghana towards Rwanda, in Rwanda we have been very strong in the blood sector. Okay. And it's something we want to achieve here too. But in Ghana, for instance, we have been very strong on the vaccine front. Across the country, but especially in Western North as well, which the distribution center in Western North is also affected.
So we learned before you start an operation in Ghana, you met some stakeholders. Before starting operation, you met some stakeholders like the Ghana Medical Association. Is that true?
I wouldn't be able to say that it's true, but I would assume that we have met most of the relevant stakeholders in the health sector at that time.
Was there a time that you were asked how your service were going to be paid for?
Whether we were asked, I mean, as I said, I wasn't there, so I can't tell you that in detail, whether we were asked.
Chief Executive Officer of ZIPLINE Ghana, you were not there?
No, I mean, I'm with ZIPLINE since last year, June. So when you're asking in terms of whether I know whether we were asked, if you ask that question in that specific manner, then I can't give you an answer. If you're asking me, generally speaking, whether I'm aware around the discussions on how ZIPLINE was supposed to be financed, the initial discussions around the system where there was the talk around government not paying a dime.
Yeah.
If it goes into that direction, I'm aware of those. I'm aware of those discussions.
Okay, so share
from
more
my
with us.
from my perspective,
Okay.
I don't think that's an advisable approach. I don't think it's a sustainable approach
It was not an advisable approach.
towards the country. I wouldn't say so.
So meaning there was such a discussion that the Ghana government was not going to pay ZIPLINE a dime for each operations.
Again, I'm referring, when I'm answering you, right, I'm referring to the same information that you are also referring to, which is in the public.
Yeah.
So that's where my response is. And now the advice, what I said in terms of advisable, is a general advice which has nothing necessarily to do with Ghana.
Okay.
For any country, what I wouldn't recommend that kind of an approach in terms of it not being backed by a specific budget and a source of where the funding can come from. Because I think there was talks around getting the funding from the private sector,
Yeah.
but I think there's a lot of difficulties sometimes with such an approach at the very beginning.
But was that discussion true? Since assuming office, have you been briefed about such discussion before the official operation of ZIPLINE Ghana?
True in what sense?
True that executives of ZIPLINE met Ghana Medical Association and said Ghana government was not going to cough a dime for your service payment, but rather it was going to be a contribution from corporate Ghana that was going to pay for the service you're going to render the country.
I mean, I'm aware of the discussions around the contribution from corporate Ghana.
Okay.
The specific thing that you're saying, Ghana Medical Association and ZIPLINE individual executives, that's not our thinking or approach.
Oh, you're not
generally.
aware of that?
No.
What was to be your core duty for Ghana?
Our core duty for Ghana. I think you're pointing at what is now also in the media in terms of the hard to reach and the emergencies, right? So that was our core mandate. But the thing is, when you look at the technology, there is so much more you can do. And even for us, if you look at that period over 6 years, a lot we had involved in knowing what are the specific benefits, what can you achieve with this kind of technologies. And when you look at what is out there, even in the media or some comments, you can see that a lot of people do actually not have a deep understanding of what it is. Because this is not, it's not a drone delivery. When you look at, even from an engineering perspective, the drone is a single-digit percentage out of what goes into the engineering.
Okay.
But then as a system, it's a combination of a centralized warehousing system with aerial logistics. And some of the effects that it has goes way beyond what we even knew is possible at the very beginning. So there's the example I pointed at Western North in terms of the vaccinations, right? So the way we were able to drive up the child immunization rates across different vaccinations, we didn't know that we could have that effect to that extent. Now there's the other one, there was a study in the Ashanti region where it compared ZIPLINE served facilities with non-ZIPLINE facilities. And there was a decrease of 56% in maternal mortality rates in the ZIPLINE served facilities. Now that doesn't just happen because now there is aerial logistics.
In which year?
I mean, the study was over a period of time, but we had similar studies in Rwanda where it was around 51%, so it's not just an isolated study that happened in Ghana. So the one in the Ashanti region is the one with the 56%. I think we launched the study last year.
Okay.
Somewhere mid last year, the study was launched, and we had an event in Kumasi. But I think the important part is to understand that it changed patient behavior. So what happened is now we had women, mothers going to the hospitals, and they now knew that the blood products, all the products they required were available 30 minutes away if they came, even if it wasn't in the hospital as at that time. So what it did was that it increased the number of women that came to the hospital, in actual fact. It increased the number of women that went to give birth in a hospital. So there's a lot of surrounding effect that this has to be looked at holistically in terms of understanding that it's a system and an infrastructure. The struggle comes when people look at it as individual drone flights. Because of course, with the individual drone flights, the natural thinking for many people would be, oh, it maybe makes sense on an island or a mountain. But when you look at the data comprehensively, you then see a lot of other areas where it makes sense to use aerial logistics. And it's not static. When I say it's not static, we have done a lot in Ghana over the last 6 years. But we can do so much more. The system can be further improved. And when you look at the Rwanda example, that's exactly what they are doing.
Okay. How are you getting the blood, or let's say the essential medical products to deliver to the various health centers?
I mean, usually we would get it from the respective agencies, whether that's a medical store, whether that is from the National Blood Service or the respective blood zones. And the reason why I said usually is not that we went to get it from somewhere else. Usually in terms, we did a lot of the pickups ourselves. From the same agencies that I'm pointing out. But I'm saying in an ideal world, right, it would get delivered to the ZIPLINE facility, then we would handle the distribution.
Okay, so
but there was a lot of bottlenecks on the supply side as well.
Okay.
And even when you say blood, Ghana, the blood that supply that we have only covers 60% of the country's needs. Okay. So ZIPLINE has been doing a lot of blood drives as well. We have done more than 300 blood drives supporting on that front as well.
Okay, so if I do understand you well, you are called as and when it becomes necessary to do delivery.
Called by who?
By the agencies that you dealt with. So either blood bank, either the central or regional medical stores.
Oh no, that depends. I mean, there's a lot of integration work, a lot of situational nuances that comes upon. The reason why I asked it depends is what you meant called by the health facilities. But with the regions and all these agencies, it depends. And one of the things that I pointed out in terms of what we wanted from the Ministry of Health, right, was twofold. Of course, we needed the finances in terms of building a sustainable business, but we are still pushing for an integrated framework where some of those things are streamlined and understood clearly across all the region, across all these agencies, so that we don't have to go and have that amount of individual discussions on different how supply should work.
Okay, so how many deliveries per your contract or agreement with Ghana government are you expected to make in a day, week, or month?
Expected. I mean, the contract, in terms of the contract, it's 150 deliveries per distribution center per day. 150? Per individual distribution center per day. So when if all 6 are running, that's the 150 times the 6, which is 900.
900. So you're supposed to do 900 deliveries per day across the 6 centers.
I mean, there's a lot, again, there's nuance to this. When you say suppose, we are willing to do far more than that. And that has been communicated, that has been like before, so we would do more, we will go beyond that one. We do appreciate that point, but I'm saying that
per your contract.
Yes.
And as you're saying, you're supposed to do 150 deliveries per each center. So with the 6 centers, summing up to 900 deliveries.
Up to, yes.
Up to 900 deliveries a day.
Yes.
Okay, so since you started operation, how many deliveries were you able to make in a day throughout these 6 centers?
I mean, we are currently, you could say maybe we are roughly doing around 100 per day versus the 150, right? Again, the critical point that I'm trying to point out here is that the supply side has to come from the agencies. We are not in control of the agencies. So we have done a lot of efforts to actually get more supply. So that's the first thing I'm saying. And it's a lot of effort spent that with a framework, if an ideal framework, the utilization of our data could be used in better manners, right? Because when you are saying this, you can, I can give you the numbers. I'm not shying away to give you the numbers. When you look at it, 900 per day, right? That is around the 27,000 on a monthly basis.
Okay.
Yes, and we have been doing, there has been months where we have done 15,000, there has been months where we have done 20,000 deliveries in a month, yeah.
Wow, you've done 15,000?
That, on a regular.
On a regular basis?
Yeah, that's what I'm saying.
That's monthly basis?
Yes, and I'm not showcasing, that's what I'm saying. I'm not trying to paint the picture of just the highest number. That's why I even painted it in that range.
Okay. So that could even be far less than how many deliveries you're supposed to make in a month?
The contract covers for up to 27,000 if you would do the maths of 150 times 6 times the 30.
27,000, and you're doing 15,000.
Again, it's up to, and we would be willing to do more than the 27,000. We would be willing to do to dive deep and ensure we make the most critical deliveries possible.
Mr. Daniel Merki.
Yes.
I believe there was a feasibility study before you kickstarted this operation. You met the expected agencies. You all came into agreement that you'll be able to do 900 deliveries in a day.
No, that's, I mean, if you go at the beginning of it, there was a scale-up plan. So there's a scale-up plan in which different, so there's details.
Let's
and
give
nuances.
ourselves your first 3 months in operation. Were you able to meet your demand?
No, but it wouldn't, that wasn't in accordance with the first 3 months. If you're pointing back at 6 years ago,
yeah.
There was a period in terms where certain things are unlocked within the contract. And
has there been any time within the number of years you've operated in Ghana that you've been able to meet your demand of 27,000 deliveries in a month?
No, again, there is no demand of 27,000. There is a contract that covers for up to 27,000, right? And the supply is coming from the various agencies under the Ministry of Health. So that is it. We are happy to do more than the 27,000. That's what we want. We need to scale, because when you look at it, even from a cost perspective, the higher it goes per the distribution centers, if you get into the 300 and 400, okay, that's when it scales.
Then I'm a Chief Executive Officer of the ZIPLINE Ghana Limited. I want to say no train and Komono. And Komo yedi na efa ZIPLINE adwuma ye o maye e wo man Ghana hanom. Eti emu fam dodo a ye bisa ne nyina efa adwuma o mo aye eno nankasa agi atom se o senka ombusumi bia no o mo de enro ne eho akande be se 27,000 deliveries and the call ye aspects awodo no enyina, but say ka say de o mo ntimi enye emane no sa essence wona so mo niema emo mo de ekono. And so it means so sinto akra and so aba ho yada ho aba ya betua empons bedwam ne ya ba ise eje makwa babiem emfa emra bedwam tumedi so on Adom TV. Still pending komo the Chief Executive Officer of ZIPLINE Ghana Limited, Daniel Merki. Dan, welcome.
Thank you.
Okay, so now tell us, is it true that as part of your deliveries you were delivering condoms in thousands?
In thousands. I mean, the way you're pronouncing the condoms, it sounds very sensational. I mean, if you want to hear the specific number, right?
Okay.
It's 1 in 20,000 flights.
One
in 20,000 flights.
Your condom supplies?
No, I'm saying, let me land.
Okay.
1 in 20,000 deliveries, flights,
okay,
contains condoms. It doesn't mean that it's solely condom in that package.
Sure.
And that's under the guise of family planning. So there's other products in there. So it's like, really, if you look at it, so 1 in 20,000, so that's 0.005%. Yeah. And the thing is, again, even with that, so I don't think it's significant, but even with that, ultimately, the Ministry of Health and the agencies, of course, in an ideal world with deep collaboration, utilization of the data, are responsible for what we are delivering. And the aim should be to have as critical delivery as possible. But then, of course, there's nuances that you would have to look in very well into the respective facilities on what makes sense to some facility. Because it might be that we are delivering to a very hard to reach area, right? And we are already delivering critical commodities. So adding another commodity to it doesn't.
Can we be realistic here?
Mm-hmm.
When did you start delivering condoms? Which areas were they delivered to?
As I'm saying, I wouldn't even know, because it's very insignificant from an overall standpoint. It's 1 in 20,000 flights.
When this thing started that ZIPLINE Ghana is delivering condoms, that has caught the attention of Ghanaians who in their mind thought that delivering condom is not an emergency health product. So why would government of Ghana give a contract to somebody to deliver condom when at least cars can do that? So can you help us to understand which hard to reach areas that you were made to do these condom deliveries that we couldn't have used cars? Because this is not emergency situation delivery.
I mean, I'm sorry to say it, but I think your questioning and even the reasoning is flawed in multiple perspectives. Because if you say a hard-to-reach area, if you want to compare a drone going to a hard-to-reach area and a car, I don't think it makes more sense to drive a car that is more than 1,000.
So which hard-to-reach area did you deliver those condoms to?
Please, I answered very clearly to that question. And the clear answer was that the condom deliveries, in quotes, the family planning, so insignificant, I wouldn't be able to give you that statistic. Because this is more than 800,000 deliveries. And I'm telling you that it's 1 in 20,000. I don't think you'd expect me to know where those are going. That's not where my focus is. That's not where ZIPLINE's focus is. This is not what we are delivering.
What were you expected to deliver?
So what were we expected to deliver? Critical life-saving commodities, which we have done. We have saved, excuse me, we have saved lives in the tune of 10,000. And then there's emergencies averted. There's so many different nuances to this. So if you want to really have a substantive discussion, then it has to be nuanced. Unless you are telling me that you yourself, you feel like 1 in 20,000 is that significant, then we can go deeper into this. I don't think it is.
What were you expected to deliver to hard-reach areas?
We are delivering, and as I said, I explained it earlier on a system-wide level, right? That it evolves beyond just emergency and hard-to-reach. There's a lot of nuance that you have to take. But of course, if you look at very critical deliveries, there is a list that we have with the Ministry of Health of products that we are delivering. And then there is a lot of other nuances that come into play. Again, supply continuously comes from the agencies under the Ministry of Health. So even if you would want to go very deep on those kind of questioning, then I don't even think that I'm the best person to respond to you. Because, sorry?
Who should respond?
No, that's what we are working on. That's what I was telling you, that in terms of the negotiation in an integrated framework, right? We want to work with the Ministry of Health, all the agencies, to ensure that we make the highest, the most critical deliveries. So, yeah, go ahead.
So as part of your most critical deliveries, did you find in your spreadsheet condom?
Excuse me?
Condom. The things that you're supposed to deliver. Was condom part of those things that initially you were asked to deliver?
I told you already that these condoms, right, were not delivered. It wasn't a box of condoms delivered by itself.
So it was delivered in association with other
commodities. And I think I have answered this question multiple times. And I would like to land. And again, my counter question after responding multiple times to it is, do you feel that the 1 in 20,000 is truly that significant that we need to spend a lot of the time talking about?
It can actually become significant if indeed you're delivering something outside your mandate. It can even be 1 pack of a condom. Because the assumption is that because you're unable to meet your delivery rate, like delivering 900.
That's not the delivery. Again, the contract is up to, right? So, of course, we would make ourselves available to support. Once we have not reached that number, right? I gave you the USID example. And ultimately, I don't like the overall trajectory of the discussion. Not because I'm not happy to answer the question of the condoms. Very open to discuss what, in terms of the data. But it's people's life at stake. So if you're now referring to 1 in a 20,000 delivery, whilst thousands of people's lives have been saved. There's an example. We have delivered more than 30,000 anti-snake venoms. And when you look at it, you have to again look systemically. It shouldn't be the comparison of, oh, a car is going there. That's not how it works. So you have a certain, let's say, a certain hospital and snake bite might occur once or twice in a year. So if you want to store the antivenoms there, you have a lot of wastage. That's what will happen. So what happens ultimately in practice is that most of the times it wouldn't be there. Now with ZIPLINE, you can centralize it. So you have to look at the wastage. Now when I'm saying we are working with the Ministry of Health. I mean, you're doing a good job in the sense that you're maybe pushing me to say something. When I'm talking about the supply, there's missed opportunities to treat.
Okay.
So the missed opportunities, that's where the focus should be. When does it happen that we have a critical delivery and we don't have stock?
Okay.
Sometimes, of course, it could be that there is a national shortage. That's one thing.
Sure.
Another thing could be that actually there is availability, but ZIPLINE does not have it in its warehouse. And that is what I'm pointing at with the integrated framework, is that we wouldn't want to have this happen in one region. Maybe we work very well, we save lives in another region based on the personnel there.
Do you ever deliver textbooks and uniform as part of your deliveries?
So that's the interesting part for you, not the lives. I mean...
Dan, you see?
No,
I'm sorry. The issue is, there's a reason Ghana government contracted you for a service.
Yes.
If you do that, it's a plus to the state and to your good service, because you're also going to make money.
Yes.
If there are excesses, people will question. That's what I'm asking. Did you ever, in your operations...
No, sorry, maybe I'm not... If there are
books,
excesses...
Yes. If there are excesses, that excess to that... For example, if indeed it's true that ZIPLINE was used to deliver books, textbooks to students, then it becomes questionable, unless maybe it's part of your agreement.
It doesn't become questionable unless it's part of the agreement.
But did you ever deliver books?
Our land. The reason being, right, as long as it does not come as an extra cost, and we, for instance, we supplied exam papers. The things are public, right?
Okay, yeah.
We delivered exam papers.
Okay.
When you look at it, if you want to look at it purely financially, right, it's not within our mandate.
Yeah.
We could have just refused to send it. Our bottom line would be better because it wouldn't have reduced the amount due to us as a company.
Sure.
So when we were doing this, we are looking at this as being at that stage, right? It's more like a corporate social responsibility in the sense that, yes, let us pick that up, especially if we are not delivering at our maximum capacity, right? And our capacity, we can do more than the 150. So the right thinking would be, why not look at how we can do 200 deliveries, 300 deliveries, drive down the cost per delivery? Why don't we look at what are the most critical ones? What could we give to ZIPLINE to do it across the nation? Because you would reduce your wastage. So that's why I felt quite resistant to go deeper and deeper on the same discussion of what were those deliveries. Because when you look at the bulk of the deliveries, right, that's not the interesting part. What is the interesting part is the vaccines, for instance, that we delivered. Interesting to the extent that Rwanda, they sent a delegation to come to Ghana and understudy what we are doing with human vaccines.
Rwanda?
Yes. And then they implemented it and are scaling.
The country where you started operations from in Africa?
Yes. That's what I told you at the beginning. They were very strong on blood. When you look at Rwanda, in terms of blood, around 75% of blood deliveries outside of Kigali, the capital city, are delivered by ZIPLINE. If you include Kigali, because there's a no-fly zone, it's around 51%. Okay. Now, human vaccines, we did extremely well. Even if you look at COVID, one of the reasons why Ghana could absorb more COVID vaccines was because we had the capacity to deliver into the rural areas via ZIPLINE. Okay. I pointed at the study in the Western North. So it's the same tinkering. So the focus should be on where can you improve it? Because up till now, I've spoken as Daniel Merki in my capacity as ZIPLINE, right? Yeah. Now, I'll speak a little bit in my capacity as a private person or a citizen of this country, right? Okay.
You're a citizen?
Yes.
Or you're a resident?
I'm a citizen.
Of Ghana?
Daniel Merki, yes. I can show you my passport.
Where do you come from?
I'm coming from, I'm from Ho. If you want to know the village, I'm from Taviope.
Oh, okay.
Yes, but let's not deviate. Let me talk on that behalf, right?
Yeah.
Ultimately, we have achieved a lot over the last 6 years.
Okay.
And you can, again, you don't have to take it out of any ZIPLINE representative. You can just go and look at the recognition that we have received, even if that's on the Ghana Civil Aviation Authority side, the work that they have done. Okay. It goes far beyond ZIPLINE. So now, if you look at these 6 years, are there things that we should do better together with the government? Are there things we should look at? No doubt, but those are the things that we should be focusing on. And that's why we are pushing for this integrated framework. Now, where this discussion is going, I think it's extremely unfortunate because it's putting the focus onto the wrong thematics. If you're telling me we delivered 10% of condoms, sorry, now I'm using the same word, that's a different story, right? But if you're telling me 0.005% and there is context to it that is very nuanced, and I'm now being questioned on where did these go? It's like, when you look at the work that I'm doing, right? The condoms are not important to me. I wouldn't know where it is going because what is important to me is where are the lives that we can save, right? And I'm saying not that condoms are not important, though. I'm saying in terms of the significance, the number
of your deliveries.
Of deliveries, it's absolutely insignificant. So I have no part of my brain is thinking about
How is your payment like? Is it a take or pay agreement with Ghana government?
Define take or pay, then I will respond.
Whether you use your service or not, you're still going to pay us.
It's like a subscription model where it's paid for up to a 150, right? Deliveries across. So there's a flat fee. And again, the right thing to do is to ensure that you utilize the data and have the most critical deliveries. And there is a lot of things where people think drones have to be expensive. It's not. It depends, of course. There's, again, now I'm also generalizing, there is nuance. But when you look at it, you have to study the data and draw your conclusions from it. So with the vaccines, for instance, to immunize an additional child, like with ZIPLINE, is around 66 cents. I'm saying an additional one. Okay. So the system is already running, and then you add. Of course, if you build up a system, it's different. So those are the things that I would love to be talking at. And maybe now I'm talking to you in that manner, right? I'm not pointing at your station or you in particular. Even with the media, in terms of, I mean, I've gotten back from media telling me, oh, they are interested to interview me. Yeah. And they are telling me that they are interested to interview me because a lot of the people from the rural areas have been calling and are worried that they might not get supply. I'm like, yeah, but ultimately, it's not our job to go and put the spotlight onto those people or me to talk about those people. The people are there. If you go into Karachi, Anum, Western North, you hear the stories of people. Even behind doors, we have, of course, I speak to representatives of the government at the different levels and stuff. There is a real impact on lives that is already happening. You take Western North, it's clear cut. They do not have the capacity. It's a new region, they don't have the medical stores, they don't have the capacity, they pick their vaccines from Takrady. And even picking up the product back from the distribution center, we had to assess they struggled with capacity to come and pick up their own commodities.
Will you be surprised if Ghana government one day says that enough is enough, ZIPLINE contract is cancelled?
If Ghana
government.
I mean, our mission is clear. What we want to achieve is we want to serve the Ghanaians across the country. Okay. If that is not possible in a particular country, right, that would mean that that partnership is not conducive to achieve that mandate. I don't believe that's the case in Ghana. I think in Ghana we have done so much and we can build upon this. And that is again where the focus should be. But again, the yardstick or the perspective at which we look at everything is, can we make impact? Can we save lives? And is it sustainable to grow and eventually provide access to everybody? If those parameters are provided, we are more than happy to contribute.
How many months accumulated to the 170 million Ghana cedis debt?
I mean, I don't want to go into the details of the payments because we are still talking, but what I can say is that, because I've seen some statements and it sounds as if that's an amount of a year. That's not the case. Okay. That's not the case.
So what's the case?
You're digging deeper. I think there was, I saw an interview where the figure was mentioned, not by me, and the information is public knowledge. But it's just, I mean, the contract is not a hidden contract, it's public knowledge. Sure. But as I said, what I want is a resolution. So I don't want to go into details of payments and how much is owed exactly. I have never quoted the figure. Even with the particular figure that you are quoting.
Which figure?
Yes, that figure.
Which figure?
I was asked the other time, and I referenced that the figure that is in the media is correct.
How much does the Ghana government owe you?
You have mentioned the figure before, so we know the figure.
So that's the figure.
That's the figure.
170 million Ghana cedis.
To that tune. A pause. I mean, I think it's clear, so we know the figure.
So how many months have accrued to this place?
I mean, maybe the last detail that I will share on this, right, is that we haven't been paid in more than a year.
More than a year.
In more than a year. That is what I can share.
So that can be around 14 months.
In more than a year.
Around 14 months.
I told you
I'm asking to drive where we are come to end our conversation is that some believe that your service charge is expensive as compared to what you're doing.
They think our service charges are expensive.
Yeah.
I would say I don't believe it is if utilized in the right manner.
Are you ready for a review of your service charge?
I mean, again, that's a matter of negotiations, right?
Okay.
But no, I would like to learn. It's like, see, but if you would want to have a negotiation to optimize something, sure, there is the capacity. If you say there's a money for value issue, right? You should look at the value side of things as well.
Okay.
Systemic. What can be done? What can be improved? How can I improve my supply? So that's one thing. The other thing is we have been providing services, right? We have been very open and communicative to improve things, to be open, to be collaborative. So at this particular stage, for us to be able to operate, I mentioned the reason is financial. So we need a payment for the services that we have already rendered to be able to operate.
Okay.
Then, in order to fulfill our mandate that I described before, we require an integrated framework where there is a clear directive on how the supply bottlenecks are solved, so that people can get access to the commodities they require at all times in the shortest possible times in the areas that ZIPLINE serves. So that's our focus. If that is solved, right, then we should be looking at what really makes sense within this overall mandate, joint mandate. Okay. I think I'm going too far.
Thank you very much.
I think we have a joint mandate that is very aligned, right, with the Ministry of Health. I don't think it should be difficult for us to come, because ultimately what we want should be the same.
Okay. Let's see. That was a Komwa Enra Mene, the country director Edmund ZIPLINE Ghana, Daniel Kweku Merki Elchinye, right after Honorable Kwabena Minta Akando press conference giving details of ZIPLINE ejubedu obudiye na ebi enura won so wanya kwan entie ensemwa onwanyamfo Kwabena Minta Akando editudwa on ZIPLINE. Yakuche bi edi ema hwe the Honorable Minister of Health, Honorable Kwabena Minta Akando on ZIPLINE.
Apart from that, their services was to concentrate on the hard-to-reach areas and emergency services. But upon review of the activities, what we have realized is that the hard-to-reach areas constitute only 12% of the activities, 12%, 1-2. And emergency services is 4% of the activities. And it will interest you to know some of the items they fly. Items like condom, blood donor cards, not blood donor cards, mosquito nets, food and nutrition items, adhesive tapes, syringes and needles, education materials, among other things, textbooks, exercise books, uniforms, and a lot more. So these are some of the items they have been flying. And so when we came to office, we think that there must be value for money. And therefore, we are engaging them. So if you hear that we are not engaging ZIPLINE, it's not true. We have met more than 3 times, and we are still engaging them to know how we can have value for money. And that is what His Excellency the President has directed us. $88,000 per center per month. $88,000 per center per month. So if you do the computation, we are paying more than, because we have 6 centers, so we are paying a little over $500,000 every month for the services of the drones. What is more interesting, and I think everybody needs to know, is the fact that in the beginning of this contract, the idea was that we were not going to use government of Ghana money to pay the services of the drones. And I have the Hansards here during the debate on the floor of the House.
So, Honorable Kwabena Minta Akano, the Minister of Health, and press conference on the Tuja, we discuss a whole lot of issues. The part about ZIPLINE, and the response here, the country director of ZIPLINE Ghana, Daniel Kokumek, and so Eddie Emaye, and so Mate. Babia will be when you ZIPLINE so fast so, and I say when you so fast so, you be the best judge in this issue. But no, I'm going to candle a case suja say a buying car so we chat ZIPLINE contract name. Government of Ghana and cars so we chat contract name. It's only a suggestion by the majority leader, who happens to be the member of parliament for Boko, Honorable Mahama Yarega. And he suggested say a beyanka Ghana government interest our contract in emu. A beyanka Ghana government interest ZIPLINE contract no emu. So as negotiations echoes no, you will hear be a sema okwana so with me I join the discussion 0302 211 701 0302 211 702 0302 211703. Also, dear now worker a day efa sa ZIPLINE and come we home. Obey me so send a WhatsApp message. The WhatsApp number no so to screen so. Now why so this is WhatsApp number 0531 029 795. 0531 029 795. But you may fresh our number we send a WhatsApp message in Kwana Efaso. But bet me a phrase 0302 211 701 0302 211 702 and 0302 211 703. Oba in Tete Mano so to me enjoying your discussion. Make us say Mr. Wada. And then ade ba ko a edi enipanya ye pa say we immune system e wo form. We immune system e wo form pa. It will be our immune system wo form. The ade bia ba ya enkanka na say sa awo ya actually team any whether ne papun ya en na mu nyina no enya ne papam. Me so da duro metimi akamfo e de amawo. Eye oppose ni no edro no. Imboost herbal mixture. O member be a turn drobiano, o kwa sabeka be ato. Imboost herbal mixture. Ebe boost your immune system. Na kwetia ya de bia e wo ni pedwem. Efanya agudie. Efanya agudie kra. Ben, good morning.
Good morning. Bibia fokotia kwesi.
Boko Ben answer e.
Yeah, me adom me hoye pa. Me first ya kuna na Thomas na am chop protection team no. Na me tia won so mugu jumapa so you see kona Adom TV station back pe. Adom TV mugu jumapa.
Yeah, that's it Ben.
Dia opening on nika say answer na oba studio we. Dia ZIPLINE no kwase konam so man pa watching film ya ma ko live reach and film apa ni pressure say sa and film na ekoso no it's me to hanam na bibia kama mtemase akwesu nyam jwa mtemase
Mate so me da say nyam kopo enka also afoko good morning afoko.
Yes sir.
Yes sir, appreciate you.
Yo, good morning. Yeah. Na mekia me papa onabo Alexander Buakete kontomra former na makia alaje do tabamu baumia e campaign team organize na mestre yinu anu mendi the abembi bana obeya de matana ona so mu hu bia omunye timu a wo hwe yenu akwa president akan do timu a o titire wo bia do na e so titire Ghana for say aduma omu di share ZIPLINE kontana ye no no mu ye se o hwe would you quite be my son of okay. But and yes, I can so the ZIPLINE for the buyer. Yeah, my almost say almost supply 150 supply a day. It is say or supply 100 cry, meaning or hate the target. And now only for you so cast and when Timon say, but you are almost supply 170 a day out. It say on my cost of financial to the sea. It is a government that can't be Tiragana and say, millions pay 4%. Now, ZIPLINE sponsor stop lines to edit both. Meaning, no person will Ghana for it.
Okay.
All the testimony is money lost. Yes, everything when we go over every kiss our control ramens anymore. And yes, ZIPLINE. Now, what is a you also? I say a dose a you also, and I read now that you also no do a control now because how can the person edit a medical business?
Madam, say opening. Hello, good morning. Atifa, good morning.
Good morning.
Atifa, Pacho free.
Akim order.
Hey, Pacho, you. Papa, you.
Akim order.
Me Pacho, menti you, Mr. Oda. Mr. Oda, we have come ofra. Menti you, it's ropa, so fra. Menti wankasa, uti wankasa wa. Ebeha junior pa. Okay, still people are interested in Mofrano. As was see, my name is Darko from Drobo in Abno region. The results we are seeing are the true reflection of the candidates' capacity. Why? During the WASI this year, YX supervision was superb. There were YX supervisors in all centers during every core subject and in some elective subjects. There was no or limited chance for cheating, resulting in this performance. Okay, my friend. We see, good morning. My name is Clement from Savannah region. The excessive use of phones in schools is a major contributor to the decline in academic performance. To address this, the Ghana Education Service should implement a strict policy on phone usage in senior high schools. Thank you. We see GES should reintroduce the disciplinary measures to ensure quality education. The teachers are doing their possible best to give good and effective lecturing to the students, but lack of discipline has resulted into this. Social media, students are sending phones and even using it everywhere on campuses, and teachers can't complain. So are we bringing up leaders or what? Honorable George Mengs, one, Kwame Yebua. So, anyway, a buyer. We should also say teachers are not caning students anymore. So there's no discipline in our senior high and basic school. Now the students were with us on TikTok day and night. How can they pass their exams? Regards to Honorable Bright Asamoah Brefo, MP for Bibiani, Anyaso, and also by a lot of messages. We say, my name is Atta inside Kumas. The reason is nowadays the students don't learn because of our poor. They don't even go to class nor prep or learn impo. Okay. Also the no. Me brana I be amfa ensi yakopon yard watch na head out for watch now. So another interesting discussion on Bedroom. This is where decency meet content to shape our nation's development. Bedini akwesi si ana sekese kuma list to record for your Esquire Sarah Parry, Richmond, Thomas, other team members nyina. Eda masano pa emoji bre. Namoka, because your number one account TV station in Ghana. Background.